Depression is a serious mental health condition that have a profound impact on a person's cognitive abilities, affecting their thinking and decision-making processes. One of the most significant effects of depression is the negative bias that it creates. People with depression tend to have a negative bias, interpreting ambiguous information more negatively. This bias strengthens negative thoughts, memories, and perspective, thus creating a vicious cycle of pessimism that can worsen depression symptoms. Research has shown that individuals with higher levels of depression exhibit more pronounced negative interpretation biases. So what this means for people struggling with depression? It means that their thoughts and perceptions can be skewed, making it harder for them to see the positive side of things and find hope in uncertain situations. Furthermore, there are treatments like transcranial magnetic stimulation or TMS. This treatment purposes is by targeting specific areas of the brain involved in thinking and decision making. TMS has shown promise in helping improve cognitive functioning in individuals with depression.
Now let's talk about cognitive deficits. So there's 5 major cognitive deficits associated with depression, which includes impaired concentration and attention, memory problems, executive dysfunction, slow processing speed, and negative bias. Let's start with impaired concentration and attention. People with depression often find it hard to concentrate. This means that they struggle to manage multiple tasks simultaneously and are easily distracted by unrelated things. For instance, they might start a task but get sidetracked by irrelevant thoughts or stimuli. This lack of focus can lead to forgetfulness, making it difficult to keep track of responsibilities or remember important details. Research suggests that these concentration issues might not be due to a direct impairment in cognitive ability, but rather a slowing of mental and physical activities known as psychomotor slowing. In simpler terms, the brain and bodies are processing information and responding more slowly, which makes concentrating harder. Next, we have memory problem. Depression particularly affects short-term and working memory. This type of memory is essential for holding onto information temporarily and manipulating it, such as remembering a phone number long enough to dial it. Depressed individuals often perform poorly on memory tests that require sustained attention. For example, tasks like the Brown-Peterson test, which involves counting backwards while retaining information, become especially challenging. Tests like the Wechsler memory scale also show that depressed patients have significant impairments in short-term memory, particularly on the logical memory test. These difficulties underscore the pervasive impact of depression on memory functions. Other than that, depression also leads to decision-making difficulties. This is part of what we call executive dysfunction, which involves high-order cognitive functions like decision-making, problem-solving, planning. Depressed individuals often find it hard to make decisions or solve problems efficiently. For example, deciding what to cook for dinner can become an overwhelming task. Research shows that while automatic processes like routine tasks often remain unaffected, executive processes are notably impaired. However, the extent of these deficits can vary from person to person. Some studies have found significant executive deficits using tests like the Wisconsin card sorting test, while other studies haven't confirmed these findings, suggesting variability in how depression affects executive functions. A hallmark feature of depression is slow thinking, also referred to as psychomotor slowing. This includes both slow physical movements and mental processes. Depressed individuals often experience a pervasive slowing of cognitive and motor functions, which is noticeable in tasks that require quick responses and coordination. For instance, tests like the trail making test and the digit symbol test, which measure visuomotor skills and cognitive processing speed, consistently show significant impairment in depressed patients. This slowing can affect everything from the speed of walking to the pace at which they can think and respond to questions. Finally, let's talk about pessimistic thinking or negative bias. Depressed individuals tend to interpret ambiguous information negatively. For example, if someone says we need to talk, a person with depression is more likely to assume something bad is about to happen. This tendency to focus on negative interpretations reinforces negative thoughts and schemas, creating a vicious cycle of pessimism. Empirical studies support this, showing that higher levels of depression are associated with more pronounced negative biases. Essentially, the more depressed a person is, the more likely they are to interpret situations negatively, which in turn exacerbates their depression symptoms.
So let's talk about neural correlates of cognitive deficits in depression. So there's two main focus here, which is structural and functional changes in brain region associated with cognition, and the neurotransmitter imbalance and their impact on cognition. For the structural and functional changes in brain region, there is four things that we need to focus here, which is prefrontal cortex, dorsolateral prefrontal cortex, hippocampus, and also amygdala. First, the prefrontal cortex, or PFC, is vital for complex cognitive behavior, decision making, and moderating social behavior. Structural changes in the PFC include reduced gray matter volume in individuals with depression. Functionally, there's decreased activity in the region during tasks requiring cognitive control and increased activity during rest, indicating an imbalance that affects cognitive performance. And for the dorsolateral prefrontal cortex is a part of the PFC involved in executive functions like walking, memory, cognitive flexibility, and planning. Depression is associated with reduced volume in this region, similar to border PFC. Functionally, there is diminished activation of the dorsolateral prefrontal cortex during cognitive tasks, which correlates with difficulties in executive functioning seen in depressed individuals. Next, the hippocampus plays a crucial role in forming new memories, and it's involved in learning. In depression, there is a noticeable reduction in hippocampal volume, which has been linked to memory impairment. Functionally, the hippocampus shows reduced neurogenesis and altered connectivity with other brain regions, contributing to the cognitive deficits seen in depression. Next is the amygdala. The amygdala is essential for emotion processing and has a significant impact on mood and emotional responses. Structurally, the amygdala tends to remain the same or sometimes increase in size, but functionally, it is hyperactive in depression. This hyperactive leads to exaggerated negative emotional response and mood dysregulation, further impacting cognitive functions. So, for the neurotransmitter imbalance, there are three things that involve, which is serotonin, norepinephrine, and dopamine. Serotonin is a key neurotransmitter that helps regulate mood, anxiety, and cognition. In depression, serotonin levels are often reduced. This deficiency can lead to problems with mood regulation, contributing to symptoms such as persistent sadness and lack of interest in activities. Additionally, serotonin plays a role in memory and learning. Low level of serotonin can impair cognitive processes, making it harder for individuals to concentrate, remember information, and learn new things. For the norepinephrine is involved in arousal and attention and respond to stress. It helps to mobilize the brain and body for action, increasing alertness and focus. In depression, norepinephrine levels can be imbalanced, typically lower than normal. This imbalance affects attention and arousal, leading to difficulties in concentrating, maintaining focus on tasks, and responding to environmental stimuli. These cognitive deficits can significantly impact daily functional productivity. And the last one is dopamine. Dopamine is crucial for brain reward system, motivation, and pleasure. It also plays a role in executive function, which include decision making and planning. In depression, level often dysregulated, leading to anhedonia and a lack of motivation. This dysregulation affect cognitive functions and related to reward processing and motivation, making it challenging for individuals to engage in any activities.
There are several methods treatment for depression. Number one is pharmacological intervention and their effect on cognition. Second is psychotherapy and cognitive behavioral technique, and the last one is cognitive remediation and brain simulation technique. Pharmacological intervention and their effect on cognition. Antidepressants work by adjusting level of chemical like serotonin and dopamine in the brain while helping improve mood. Some of these medications also have positive effect on cognition, such as enhancing focus, memory, and skill, like planning and problem solving. However, it is important to take note that antidepressants may initially cause some negative cognition side effects too, like drowsiness or difficult concentration at first. That's why it is important to work closely with your doctor. They can help to find the right medication and dosage to lift your mood while minimizing the impact on your thinking and cognitive ability. Cognitive behavioral therapy, or CBT, is an effective psychotherapy method for depression. It focuses on changing negative thought pattern and behavior related to depression. In CBT, patient learns technique to correct disordered thought that contribute to their depression. This helps them develop more realistic and positive thinking. CBT also includes strategies like mindfulness to stay focused on the present and behavioral activation to engage in enjoyable activity. By changing negative thought and behavior, CBT can reduce depressive symptoms and improve overall well-being. It's like exercising our mind to think more positively and feel better. Through CBT, individuals can better manage their depression and cultivate more positive mindset. Cognitive remediation therapy, or CRT, involves doing computer exercise personalized to improve areas like attention, memory, and problem-solving skill. The exercises get more challenging as the person progresses. CRT teaches behavioral strategy and boosts confidence in cognitive ability. It's often used alongside the medication and talk therapy. Another approach uses brain simulation technique like transcranial magnetic stimulation, or TMS. TMS uses magnetic field to stimulate specific brain areas important for thinking and decision making. While more research is needed, CRT and brain simulation technique offer innovative way to help improve cognitive functioning in individuals with depression.
For the conclusion, depression is more than just a mood disorder. It has a far-reaching implication for cognitive ability and overall well-being. By addressing both emotional and cognitive aspects of depression through a comprehensive treatment approach, individuals can regain control over their thoughts and behaviors, while improving their cognitive performances and ultimately achieve a higher quality of life. That's all from us. Thank you.